Sociopathy, a severe mental health disorder, is associated with manipulative and exploitative behavior that consistently disregards and violates the rights of others. The onset of sociopathy generally occurs in adolescence or early adulthood. This condition impacts approximately 1 to 4% of the population, predominantly affecting males. The Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association, is a guide used by mental health professionals to diagnose mental conditions. According to this diagnostic manual, antisocial personality disorder, which is what causes sociopathy, is diagnosed when a person exhibits a pervasive pattern of disregard for the rights of others. In order to be diagnosed with antisocial personality disorder, the individual must be at least 18 years old and there must be evidence of conduct disorder with onset before age 15 years. The occurrence of antisocial behavior must also not occur exclusively during the course of schizophrenia or bipolar disorder. A significant trait of sociopathy is an individual's persistent non-compliance to social and lawful norms. This can manifest as repeated engagement in activities that could lead to arrest, showcasing a blatant disregard for the law. Sociopaths often exhibit a pattern of deceitfulness. This may involve chronic lying, adopting false identities, or scamming others for personal gain or satisfaction. Their deceitful nature is a tool used to manipulate others and situations to their advantage. Impulsivity is another common characteristic of sociopaths. They tend to act on a whim, failing to plan ahead or consider the potential consequences of their actions. This impulsiveness can lead to unpredictable and sometimes dangerous behavior. Sociopaths often display high levels of irritability and aggressiveness. These traits can result in repeated involvement in physical fights or violent assaults, further demonstrating their disregard for societal norms. Another alarming trait of sociopathy is a reckless disregard for the safety of themselves or others. This indifference towards safety can put both the sociopath and those around them in harm's way. Consistent irresponsibility is another telltale sign of sociopathy. This can be seen through an inability to maintain steady employment or meet financial obligations. The failure to fulfill these basic duties demonstrates a lack of commitment and reliability. Perhaps one of the most troubling attributes of sociopaths is their lack of remorse. They often remain indifferent or rationalize their actions after hurting, mistreating, or stealing from others. This lack of guilt allows them to continue harmful behaviors without experiencing emotional discomfort. It's important to note that not all sociopaths are violent or criminal. Some may be high-functioning individuals who excel in their careers and social lives. Sociopaths frequently exhibit a captivating charm that is often skin-deep, coupled with a high degree of intelligence. Their eloquence, wit, and engaging conversation skills can make them appear alluring to those who are not intimately acquainted with them. This charm, however, is typically a facade used to manipulate others. Despite the severity of their disorder, sociopaths generally do not exhibit delusions or other signs of irrational thinking. They are typically rational individuals who maintain a clear understanding of their actions and motivations. This trait further equips them in manipulating situations to their advantage. Arguably one of the most telling traits of a sociopath is a profound lack of remorse or guilt. They have the capacity to cause harm to others without experiencing feelings of guilt or expressing regret for their actions. This emotional void allows them to disregard the effects of their actions on others. Sociopaths are notorious for their propensity to lie. They possess an uncanny ability to lie convincingly and effortlessly, often using deceit as a tool to manipulate others for personal gain. Their lies can be so convincing that they sometimes manage to deceive even the most discerning individuals. Manipulation is second nature to sociopaths. They are often cunning, using flattery, persuasion, or playing on a person's sympathies to achieve their objectives. Their manipulative tactics may vary, but the end goal is always to control others and bend them to their will. Sociopaths often display a marked inability to stick to a life plan. They may lack long-term goals, frequently change jobs, relocate on a whim, and act impulsively without considering the potential consequences of their actions. This lack of consistency and predictability can make relationships with them chaotic and unstable. While the terms sociopath and psychopath are often used interchangeably, there are key differences between the two. Both fall under the umbrella of Antisocial Personality Disorder in the Diagnostic and Statistical Manual of Mental Disorders, but their behavioral patterns, emotional functioning, and origins of the disorder can vary significantly. Sociopaths tend to be more impulsive and erratic in their behavior compared to psychopaths. They're likely to make decisions without thinking about the consequences, leading to unpredictability. In contrast, psychopaths often display better impulse control. They plan their actions meticulously and can lead seemingly normal lives while hiding their manipulative and harmful behaviors. Psychopaths are often charming, highly manipulative, and adept at mimicking emotions to blend into society. They can maintain long-term relationships and hold steady jobs, making them difficult to identify. Sociopaths, however, often struggle to fit into societal norms due to their impulsivity and visible lack of regard for rules. This can result in unstable relationships and inconsistent work histories. The development of sociopathy and psychopathy is believed to be influenced by both genetic and environmental factors, but the emphasis differs. Psychopathy is generally thought to be primarily genetic, often evident regardless of upbringing. Sociopathy, conversely, is often linked more strongly to one's environment and experiences, such as childhood trauma or neglect. Dealing with a sociopath can be challenging due to their manipulative nature, lack of remorse, and disregard for social norms. Your priority should be your own well-being. Establish clear boundaries, trust your instincts, and do not allow yourself to be manipulated. Remember, it's okay to distance yourself from harmful individuals. You deserve respect, safety, and honesty in all your relationships. Stay informed, stay vigilant, and always prioritize your mental and emotional health. For more information about sociopathy and sociopathic abuse, visit www.carlacorelli.com.